Good afternoon or good evening. Today we're going over entry-level muscles and bones recognition. Pardon me. What you need to know is you need to be able to identify all the major muscles and bones. They're overkill. I've given you 6 different aspects here. We've got right on the slides from top down in descending order. I have what we call the scan jobs, and we've got the muscles and bones, all in different aspects. People learn different ways, so that's why there's 6. We have 2 different aspects for the bones. This is simple. Pardon me. I think it's simple, but first year level muscle identification, and then on just some of them, some of the functions, so that you understand, for example, what a rotator cuff is and what muscles comprise the core. Heading down from the top, you take a look at your first, and this is slide 1 that you have in Moodle. Just a sidebar note, I've not getting any more questions, so it means everybody must be on here and able to navigate. I do apologize, some of this people don't know how to work this and understand Moodle and how it works. We will be playing around with Google Classroom as well. Lots of emails and text asking about how will we get into groups. Well, Moodle is more cumbersome, and by the law of the university, we have to use Moodle. That's okay. I'll put the platform on Moodle every time, but we'll also be using Google Classroom, and I'll post the passcode for that, Google Classroom for Phed 1230, and I'll post that here tonight so that you can access that. I'm asking you to join that. I will use both platforms by the letter of the law. Okay, so we take a look at the first, getting into the muscles, and I'll try not to speak too quickly to you here, so that I kind of have a little bit of this information that we could go through on Zoom later at a later date. Presently though, you take a look at from the top down, taking a look, I'm not concerned about the facial muscles. I want functional muscles that we will use when we do our small or adapted lab settings, which will be at your own home or in the gyms, wherever it is that you live. Taking a look from the top down, we take a look at sternocleidomastoid. You need to know sternocleidomastoid. I'm going to say that for every single one that I talk about. If I do not speak on it, you don't need to do it. We have 40 questions on each of these, so we're up over 240 plus through the slides that we'll go through today, if we get through them all. It's pretty easy without question and answer, so I'm going to try not to. I'll try to go through them as quickly as I can. So when we come down, sternocleidomastoid is responsible for rotation of the cervical region. And I'm down on the left-hand side, facing screen, then we'll go down onto the right. Trapezius, why is trapezius important? Well, it's in the strength and conditioning world, it's a bone of contention for some people. When do you train that? Do you train trapezius? Do you train trapezius on shoulder day, or do you train it on back day? The answer is either. But if you for sure are doing muscle isolation, then you want to take the trapezius out, because it's a large muscle group, as we'll see in the next slides, and so is the latissimus dorsi, so you want to separate that. Pec minor, see where it's located, right through the mid region of the chest. Easy enough. What does the pec do? Well, pec is very instrumental in the opposing muscle group to the latissimus dorsi as far as push-pull type of workout schedules go. Serratus anterior, right up into what you would call your armpit now, but you'll call it your axilla. Moving down through to the bottom where we've got part of your core musculature, and we're going to group those as obliques. So internal and external obliques. Very instrumental in rotation of your vertebral column. Iliopsoas and the psoas group is what you used to call your hip flexor. So what does it do? Flexes the hip. 2 muscle groups there. I'm not going into the generics, but please take a look down at looking through your adductor longus. So adductor longus is an adductor. What does adduction do? Adduction draws the segment towards the midline of the body. From there, another one that's instrumental also is your gracilis. And then of note, IT band. IT band track, this is for you people who, you're running enthusiasts. Later on into chapter 4, we'll get into these type of syndromes that we have here as well. So IT band right down close to your femur, and that's the one that hurts when you foam roll it out. Adductor magnus, another group on the inside here. You'll notice the region that adductors lie. inside of the leg, in contrast to your abduction. So adduction, AD adding the segment toward the midline, AB pulling it away. Over to the other side, we don't do tendons and ligaments in this class, but if I can somehow turn you people on in this time to take other courses as we go through 2210, exercise physiology, we'll get into all of the origin and insertion sites as well. Minus facial muscles, here we go into pec major, the largest muscle group of the pec. As we go down and go through, we've got deltoids, and all I want you to know is just to be able to locate, so medial aspect of the deltoid, and anterior means the top, medial means the middle, and you can see where the lines go here. It's a very clear picture. Biceps brachii to biceps brachialis. Biceps brachii, the thick part right in the middle, brachialis on the outside, and we'll go over in the lab notes on how to hit both of these muscles and recruit the fiber. Brachioradialis, big muscle on the outside. How do you train those? Are for you people who that's implicated in the hammer curls and runs from your bicep region right down to your forearms. We leave those ones alone. Look on the top, tensor fasciae latae, TFL, runs kind of in harmony with your IT band, right? And then down through sartorius. Why is sartorius, in my mind, so cool? Well, it crosses two joints. So it's big, and we've got it here on your iliac crest, come right back down through the back side of your tibial plateau. And now we've got your quad group. So we have rectus femoris, middle, vastus intermedius that you can see just here, which people would call your teardrop, and underneath the rectus femoris, made a mistake there. Vastus intermedius is underneath your rectus femoris, and that's your quad group. So please don't forget vastus medialis, very good medial support for the knee joint. As we move through, tibialis anterior front. So this is an implicated zone. Athletes will complain often of tightness pain here, and the default usually is, shin splints. Well, shin splints are pretty hard to get. So these stream into all sorts of different forms into the compartment in your gastrocnemius and your soleus on the back, pulling hard on the tibialis anterior. If you want to try that out, take a foam roll and put it on tibialis anterior and see if it relieves any pressure for some of you people who have never done that. Next slide, 1 second. Slide 2, muscle and bones, number 2 down in descending order on Moodle. Here we go, posterior view, posterior aspect. Down through now we get to take a look at what I was talking about. If you take a look at the size of the trapezius and knowing exactly where that is, then underneath is the rhomboids, but we'll go over that on the right-hand side, pardon me. And then taking a look how big these two groups of musculatures are. Large muscle is the trapezius, especially for the length of it. And then take a look at it. Inferior to that is your latissimus dorsi. As we go through, deltoids again, we've gone over that. But if you take a look now, we've got triceps brachii. So triceps brachii, if you take a look on the back side, the lateral, long, and medial heads that comprise your tricep, and look at the area in which they run. We won't do the origins and insertions here, as long as you can identify triceps, biceps flex, triceps extend. Down again, there's your serratus on the posterior aspect, and then we'll get into the glute group. So the glute group, glute med or medius up on the top, and then we have maximus. I'm not going to get into the fingers, but take a look at the size of the maximus as we go through. What does your glute do? It extends the hip. Once again, through on to the quad group, we have vastus lateralis on the outside, medialis on the inside, comprising the quad. Hamstring group for the three muscles that need you to be able to locate, biceps femoris, semitendinosus, and then semimembranosus. Now, if you take a look down low, common injury sites are never fully in the muscle belly, but up into the top anterior and the posterior inferior aspects of the hamstring group. Muscles that you used to call your soleus, or sorry, part they used to call your calf, are now called gastrocnemius and soleus. Taking a look what they do, if it's hard to see me right now, but they help in the flexion, and we'll call that now plantar flexion towards the ground when you point your toes to the ground. Sorry, people, it's hard to lecture into this phone, and I get really happy going over these things, but I can't get up and show you all of that. So I'll make sure I explain this. Then when I go over the lab, I'll make sure that I do it again. What I like on the top part here, right-hand side, levator scapulae. Levator scapulae from the time down here is also implicated or instrumental in rotation of the cervical spine area. Of note, rhomboids. So rhomboids in here, superficial, underneath your trapezius. And then we've got rhomboid major. We're going to go over these in a little bit so you know what comprises your rotator cuff. And from this view, you can see very clearly you've got infraspinatus down below the spine of the scapula. And then you have supraspinatus up on the top of the spine of the scapula. And we'll get into all those movements after. As long as you can understand, there's 4 muscles of the rotator cuff. And we're just missing the subscap, but that's coming in a different slide. Where am I now? We've got teres minor, did that, deep wrist. We've got the glute minimus, piriformis. There's another part implicated in the glute complex, gluteal complex. Why is piriformis very important? Well, many times when athletes need to increase speed, you need to take a look at the piriformis. On the athletic therapy side of my life, when we dig deep into muscles that aren't firing and we hook up the electrodes and take a look, piriformis is often like that, coupled only with gemellus superior, which is right here. Of note, back side, adductor magnus, so we're adding it in, adductor magnus, another posterior, bringing the limb segment in towards the midline of the body. And just down here, another view of the soleus, which is in harmony with the gastroc, which of course gives you your plantar flexion. Slide 3. Another nice view, a little bit more color. If those didn't work, this one came through a lot better than the other ones. The same muscles that we went through, just a different view. Of note on this slide, please, is we've got subscapularis, and it's in deep onto the head of the humerus. So just generically, the 4 rotator cuffs the 4 muscles that comprise the rotator cuff that you must know. We've got supraspinatus onto the top. We've got infraspinatus on the bottom. We've got teres minor, and we have subscapularis deep inside. What do they do? Different movements each, but responsible for internal, external rotation of the humeral head and retraction of the scapula in the back. Scapula, pardon me. All down, same muscles we've gone over already, just a better view, internal, external oblique, understanding the abdominal wall now. So abdominal wall, generic terms at a 100 level class. What are the muscle groups, the large muscle groups that comprise what we call the core? There's a lot of information on this, and some, well, that doesn't, the core, the serrate musculature, it doesn't comprise that. I'm telling you that the most accepted theories of muscles that people use to describe the core are as follows. So your oblique group, which is your internal and external oblique, transverse abdominis, up and through what you call your hip region, through the bottom. And then we have the rectus abdominis, which is the movie star muscles down through the middle, superficial, but important. And then the back side is we've got your erector spinae that go deep into your gluteal group and just about comprise the majority of the length of your spine. Here's your adductors again, just quite a nice view bringing in, you can see where the muscles will pull the femur bone into the midline of the body. Right hand side, I take the head out of it, then we go again to be able to label the deltoid, the anterior part, the medial aspect we talked about, pectoralis major, the large muscle into the middle, and then down into the core musculature of the rectus abdominis. biceps brachii, which gives you your peak, the Arnold muscle, if you will, brachialis just on the outside, what you would call lateral now, onto the inside would be medial. And then all of these muscles that we have on the hand, for this class, we have to be able to locate the flexors and the extensors. So in anatomical position, standing up, anatomical position with your palms out. Anything that takes the hand and brings it to the midline or into the inside of the forearm is a flexor. Turn it over on the outside, put the back side of your hand upwards towards the outside of your forearm, and that's extension. So extensors, flexors. You must know. Your quad group, again, better picture. Look at rectus femoris, right down through the middle. And what does the quad group do? It opposes the hamstring, which extends. The quad group flexes. It also gives you a lot of power, which we'll just discuss in the lab as well. Intermedius right underneath. You can't see it, so that one is under the rectus femoris. We've got lateralis on the outside and medialis on the middle, pardon me. Tibialis anterior down the lateral aspect of your shin or your tibia. And then we have gastroc, or the soleus that you can see just a bit on the outside, gastroc on the other side. And now on to number 4. Similar, very clear. Focus on this, please. Now, I've moved over to the right-hand side. I'll give you time if I've gone too fast, but I think I'm doing okay here. Try to keep these under 30 minutes, people, and let's try to hit a couple of these every week. But now you've got a very graphic depiction of what the rotator cuff looks like. Well, it's rotator cuff. Well, people don't know exactly what it's comprised of. So you can take a look on top and you have supraspinatus up on top above the spine of the scapula. Infraspinatus, larger muscle group below the spine of the scapula. And then you have teres minor. Look where all these muscles originate and then insert. So insert right on the head of the humerus. And then we've got subscapularis. It's hard to see, but it's up in here. So up on the other side of the scapula that you cannot see. So that's your rotator cuff of the 4 muscles that you need to know. The rest is similar as we go down through them. I don't need to go over them again. We've gone over the deep gluteals. We've gone over the muscles that assist in the glutes that are part of the complex. So we'll move on. Number 5. I think if I got this correct. All right, here we are. Bony landmarks. Full here. You do need to know all of the major bones that we go through. Depending on where you want to go, some people are taking this course as an elective, just a general curiosity type of class for life, health, and fitness. I understand that. Right? The rest of you are going to have to know all these tuberosities, all of these fossas. So the extent of this course is not allowed to cover that because I teach exercise physiology, and we do that in there, and we also do it in 1590, 1690, introductory anatomy and physiology in the first year courses and in the science courses. So hopefully you'll take all of those, and hopefully you'll like them as much as I. When we do the live, I'll have this skeleton to be able to go over these, and so you can take a look at the landmarks that I need you to know. Other than that, you just need to know the bones and where they're located, particularly so we know which muscles sit on top, posterior, anterior, of the muscle groups. So we can tell when you've got injury to one part, you know which bone is implicated and you know which muscles are as well. Left-hand side, simply know how many we have and the regions of them. Okay, so cervical 7, thoracic that we have down, and look at the order that they from ascending to descending, from the top to bottom. So when in doubt, the top part of the region is always your 1s, the bottom part is your last number. Cervical here is 7, we have thoracic to 12, and we have lumbar, the pain zone, the big pain zone down the bottom where it fuses in, to the fused bones of the sacrum. And this is what you have to, so this is what's called, through this area, through the bottom of this pubic symphysis to the bottom of your ischium here, and where your femoral heads come in, This is what's called your pelvic floor. And we go over all sorts of science of pelvic floor training. You'll hear that. Posterior chain training, which is the back aspect of the femoral and into the tibial and fibular complex. So going through that, being able to understand where your sacrum is, that these are located through your femur, the biggest bone in the body. That's the danger zone for you extreme sport enthusiasts, just due to its close proximity to femoral artery. And that's the one that many times when you break a femur, you've got damage to the femoral artery, and that's just what always results in a loss of blood. I've seen a few of those in my life. Fibula on the outside, tibia on the end. That's all you have to know for that. Just be able to know where these bones sit. Head, skull, knowing that we have sutures in the head, and you've got parietals on the sides, and then occipital in the back, and then sagittal right down through the middle. So these are just lines where the bones fuse in. Now taking a look at where the rotator cuff inserts, and where the rotator cuff lies, where it originates, where it grows into a bone, if you will, and then it inserts up onto the humeral head. Of note, this is a terrible design for what we ask of this part of the body. Throwing, above arm movements. We're going to get into a lot of this. So this is where you get to see how ill-prepared this joint is for what we do. So be warned, you CrossFit enthusiasts, when you're doing all your handstands and you age and over time, we don't want to get ourselves to a place where we impinge this joint. And there's a labrum in here, which is kind of a shock absorbent and a gliding of an articulating surface. We want to make sure that we take really good care of this. And now you know your rotator cuff muscles. So these are all of the scapular retraction exercises, internal, external rotators from all the different views. Very, very important, because this is a joint that's ill-prepared. So we've failed ourselves in the evolutionary process here. In contrast to the hip, and you can see right from here that you've got this deep socket, and you've got the head that is very similar to the humeral head that goes in. And once again, you can take a look, supraspinatus fossa, where all the rotator cuffs come off of this area here, except for and subscap, but on the anterior aspect, and all go across this humeral head. So rotator cuff injury, well, which one? We need to know all four, and you do know. Okay, Lacronon process, we need to know that once you do your home labs. Of note, people, the labs that you'll get, you've all got your lab book. We cannot do all of that. I just got the directive from the university. Everything has to be changed to be able to be done at home. So that changes the course. The tests will not be how I do have that directive as well. The tests will not be how I told you. I'm going to make up something else, and I can send it home. It will be whatever you're being tested on. It will be open book. I'm just going to make it a little bit difficult if it is open book. Okay, so know that much, please. Keep moving through, taking a look from outside of the head, neck of the femur, and there's your deep socket that you've got. Top part is called the trochanter. Taking a look as we go through here, we got the coccyx, which is this little few tiny bones on here, which you used to call your tailbone. As we move down, of course, that's your femur, long bones, coming down onto, you just need to be able to label them, all right? And then all the way through when we get down here. But of note for you, we know tibia now, we know fibula from the left-hand side. But taking a look here at the big bone in your heel, we want to make sure you understand that's your calcaneus. We'll get into the talus or talus on the other side. But we're facing an anatomical, we always do that. And we've got lateral malleolus on the outside, where your ankle gives way to your fibula, which is on the outside, and then your tibia up the middle. And the medial aspect is the medial malleolus. So that's a complex here where the fib sit on top of the calcaneus and articulate with the talus, pardon me. To 6, all the way down to 6. There we go. A few more aspects to take a look at. Just gives you a little bit better view. If you go to the right-hand side, we've gone over everything that you need to know, except for when we get into the hand. If you take a look at the scapula, right hand side. I'll slow it down here. You need to know where the coracoid process is. Here, that's a big insertion site. The reason this is implicated, we've got biceps tendons, then we have triceps on the posterior aspect that run through here. We've got all of your pec muscles and tendons that come across this joint. So this gets implicated a lot in throwing. It's one that also breaks. And then we've got the acromion. So that's where we're coming across the clavicular joint. So we've got the clavicle that comes across and joins up on the humeral head. So that's your AC joint, acromion and clavicle. So that's a process that seats the clavicle that you used to call your collarbone, but you do not anymore. All right. As we go through, yes, this is your sternum. What's important here through your vertebral column and sternum, well, it forms a base and a fusion site of your ribs. As we go down, taking a look at your ribs through, you can read through that 7, 3, and 2 from true to false to floating. Arms, when we take a look at back over to the left-hand side, clicking over, and we've got radius, which rotates the thumb side, and then we've got the ulna, which seats all of your fingers. So we have to understand that. Radius rotates the thumb, seats the thumb, ulna seats the fingers. Simplistically put, going through your hand, first series of bones. You don't need to know all the little pieces here yet. You need to understand that you need to know that those are your carpals, giving birth or giving way to your metacarpals and your phalanges or digits down into your finger, which are your fingers. Look at the pelvic floor that we talked about, the zone across the bottom of the pubic symphysis, or symphysis pubis, as this one reads, through the bottom, and you've got two lines here, and you've got anterior, superior, and inferior iliac spine. So that is your pelvic complex, pelvic floor down low, inferior, posterior, and giving away to the neck of the femur, to the trochanters, to the head of the femur, all the way down. Patella is your kneecap, and then tibia and fibula, and then down on the bottom, you've got a left-hand side, you get to see the talus, which is sitting just below the inferior aspect of the femur. Tibia, Feet follow suit, the hands, grouping of tarsals, metatarsals, phalange digits, which are your toes. Okay, that's a short version. That's usually how long something like that takes. Go through all of those. We will have a little quiz sometime on those. I'm not sure how I'm allowed to present that yet, but we have to have some testable things for you. It can't just be projects that we send home, so I'll be working on that. We have lots of time. Next day, we will go over the lab book. So moving through the lab book, there won't be much of a time frame on that, but the lab book will show learning, and the lab book will be on your test. So the lab book itself, that's yours to keep. You won't be tested on a separate lab exam, but the questions from the lab book that we can will be incorporated in. So it'll be a little bit changed. I'll come up with something so that you can test your knowledge. I want to have at least 4 things for you to show your knowledge. At present, we have a literature review that we'll be going over next week. It says September 23rd. I have to back that one off just a little bit, just because of the delivery of how this is. And we will go over that next day or next week. You'll have a week to turn that one around. I just have to get you set up first on Google Classroom. Google Classroom is the platform or area that is very, very easy to get groups set up. Okay, so your group projects, we might not do that. I need to tell you that too. This course is evolving and working on it every day. You might just be doing a project. I'll scale it back so it's not so much work, so that you can do it yourself. I know not being here and being able to meet is difficult even with Google Classroom, but I'm going to open it up to you, and you can see if it's easy for you to navigate. I will tell you this: I think it's very easy to navigate in contrast to Moodle. Moodle's good, we'll still use both, but that's going to be a little more of an interactive type of platform so that you can hand things into me and it goes right into the Google Classroom. Okay, I got 7 seconds. I'm trying to keep these to 30. Thank you very much, and we'll be back on here Thursday to go through lab books so that you know what's expected of you. We'll go through it all. I'll shut it off. Then you'll have time to go do that without deadlines on the lab book. And I will post, after I post this video, I'll post the passcode or the password for Google Classroom under Phed 1230. Thank you. Be well, young people.